The shows we've done with you, I think in the future, somebody can look at these as part of a history of COVID because the first time we talked to you was pretty much at the outset. I mean, we can kind of say it's expected that the numbers would go up, but what accounts do you think for this big expansion that's happened fairly rapidly? I've read several different things. Some say it's people going to bars and restaurants, or it's college kids on campus, or it's just people who are being, careless, or it's weddings and things like that. Is there any kind of one or two things that really stand out?
Well, I mean, I think it depends, based on where you are, which state you're in, and what's been opened up at which times. I think schools, university campuses, and other schools are probably can be the roots of a huge amount of spread. I mean, schools for little ones have always been a really contentious issue. Are we going to open up the schools? Because traditionally, it's not the kids in our community that are showing up in the ICUs, right? And so I think there's been a lot more pressure to open up the schools for younger children. But kids still represent about 10% of the cases that we see in our communities. They might not be getting as acutely ill, but they're definitely contracting the virus. They're definitely testing positive, and they're definitely then able to spread to other people. So I think that schools can't be discounted as potential areas of spread. And then, of course, sporting events, I think that everyone has done their best to try to, nobody can be in the stands. And last time we talked about this, that there's no way. I mean, and I like watching sports. And so when I watch, Monday Night Football and everything, you see the players are, when they're on the field, they don't have masks on, but then even when they're off the field and the coaches and everything, they're pulling their masks down, they're hugging each other, they're doing all these things. So that definitely has caused some spread. Yeah, I mean, it's hard because we have these major life events like weddings and baby showers and all these things that we want to have and we want to participate in. And oftentimes we've spent a lot of money to prepare for. But that is a real risk right now. It's a real risk of spread.
And this week is Thanksgiving. And so a public opinion poll I saw from last week said that 40% of people were still planning large family gatherings. And so, if you have a big family dinner for Thanksgiving, can you expect a more dire gathering, for Christmas, like a funeral or something like that?
Yeah. Well, so I think a lot of people have pushed back really hard against some public health professionals who have basically urged people to cancel Thanksgiving. That's a really uncomfortable message to give. It's also an uncomfortable message to receive, but I don't think it's alarmist at all for us to consider that, or to have it over Zoom or something like that, which is, I know, not as satisfying as getting together with the people that we love. I think there's two things to consider. There's one is, are we going to have the big dinner together and watching football and all of that? The second question is, how far are we going and how are we going to travel to said dinner, right? So if I am sheltering in place in the Bay Area and I can get tested and then, have one person come over and have dinner with me, we've both been tested, that's a very different risk versus getting on a plane and going to hang out with grandma and aunts and uncles and cousins and all of that. So it's, but yeah, I'm not personally celebrating Thanksgiving in a traditional way. I'm not going to be seeing anyone except for over Zoom. Of course, I've been really restricting myself pretty much more aggressively than other people because I have had contact with folks who are ill, and do so regularly. But I don't recommend it. It's not worth it.
To be a little more kind of, if we could, I don't know if you could be more specific, speculative, I guess, saying, don't celebrate Thanksgiving almost sounds like teaching abstinence, right? That kind of gives you the impression you have to stay home. And most people aren't going to do that, even people who are kind of, being pretty careful about this. So is there kind of a line where you can do it more reasonably, safely than not, like, immediate family or just 4 or 5 people or something like that? not one.
Yeah.
Good. Yeah.
No, I agree. I'm a huge fan of harm reduction. So yeah,
Yeah.
abstinence only doesn't usually work with anything, and COVID is
Right.
no different. So yeah, I think there's a lot of things that we can do to reduce the risk. If we're going to get together with other people, I think trying to get tested reasonably soon before we're going to have that interaction is good to say, okay, I can be sure that within the last 5 days or so, I have not, I don't have the virus. I've heard of some people who are taking people's temperature when they walk in the door at the Thanksgiving dinner, which is probably going to feel like a pretty bizarre thing, but I don't think it's actually out of the question. Again, not everyone launches symptoms the same way. And so just taking a person's temperature doesn't automatically tell you, if they don't have a fever, that doesn't automatically tell you they don't have the virus, but it can be some sort of a marker. I think if it's at all possible, eating outside is a really good idea. So if you can, I don't know, if it's cold, like maybe having your Thanksgiving dinner really early in the day so that you can eat outside would be a really nice option, and spacing yourself around the table, and then wearing a mask when you're not eating as much as possible. Obviously, hand sanitizer, when the virus is killed by, when you cook food. But if you're going to be serving anything that's cold or chilled or not coming straight out of the oven, I would say to wear a mask while you're preparing that and handling that, and trying to avoid kind of buffet style. We typically will do like sort of buffet style serving with a lot of these parties. So trying to avoid that. If you have to be inside, maybe even just opening a couple of windows can increase air circulation a bit. So yeah, there's some good harm reduction techniques that we can use. And then I think Zoom is our best harm reduction technique, if that's possible and palatable to you.